making sure children are healthy, safe, loved, ready to learn, succeeding in school and in life. This is Our Children, a program brought to you by the Children's Trust.
Good morning. I'm Modesto Abedi Gutierrez, President and CEO of the Children's Trust.
And I'm Ileana Varela with the Herbert Wertheim College of Medicine at FIU. And together we welcome you to Our Children. You know, the beginning of the Florida legislative session is only days away. Governor Rick Scott has announced his proposed budget with increases in education funding for the first time in years, as well as his support for Medicaid expansion. But there is still much more on the table you need to know about.
Today, we're going to talk about expected policy debates in the arena of health and early childhood education. The implementation of the President's health care reform plan will shake out in the coming months, and in the KidCare program, immigrant children could be left out in Florida unless lawmakers act.
Although the number of uninsured children in Miami-Dade County has dropped from 110,000 10 years ago to 79,000, Florida still ranks 48 out of our 50 states in the number of uninsured children. That's certainly not something to be proud of. To get this conversation going, please welcome our guests, Maria Alonso, Board Chair of the Children's Trust and Chief Operations Officer of Citrus Health Network; Steve Marcus, President and CEO of Health Foundation of South Florida; and Diana Ragbeer, Director of Public Policy and Communications at the Children's Trust. Welcome all of you to the program. Thanks for being here.
Thank you.
Maria, what's the latest on implementing the Affordable Care Act in Florida, and how could this impact children?
Well, I think that to answer the question, I need to put it within the policy perspective. And I think that when you look at the Accountable Care Act, it really was about insurance reform and making sure that everyone had health insurance. With that premise, then you begin to see all of the implications of policy coming out around changing payment mechanism, changing rates for payments. And I think the key here is that the governor actually did make the right decision for Florida. Economically, the impact would have been disastrous if we had not had, or we don't have, the Medicaid expansion. I think it's going to be very important for us to work with the legislature and the Senate to get that approved. Because we already begin to see how it's impacting providers. For example, hospitals have already begun to see rate decreases, with the understanding that if you do have healthcare reform, there are going to be more people that are insured. So expanding Medicaid is critical because that's actually going to help the working poor. And those are the people that show up in the emergency rooms because they don't have healthcare and will eventually cost more money for the state. So definitely that was the right decision. I think once the exchanges come up, and I know that Florida is waiting for the federal exchange to come up, and they'll make the decision later on whether we do our own or whatever, that's also going to help because people will be able to get subsidized health insurance. So definitely the whole Medicaid expansion was a good first step. We just need to make sure that it's approved by Senate and legislature, and that's really our work to do that.
Steve, what's your take on this?
You know, Mo, when you're uninsured and you're sick, you don't get up in the morning and call your doctor. You don't get a prescription over the phone. What happens is you wait until you feel worse and worse and worse. And by the time you go to the emergency room, you need more care than you would have if you had made that first call to your doctor. So it's about getting health care through early intervention. And it's also about being able to make a difference in the long term of people's health. Because when they start to get a benchmark for where they are with physical examinations, then they know how they're progressing as they get older. And that helps them stay on the right path to health.
And it's about preventive health as well, huh?
Yeah, Health Foundation of South Florida, one of our major issues is wellness, disease prevention, health promotion, and primary care. And that's a lot of the benefit of this Medicaid expansion.
Let's get back to the uninsured. Diana, there's something called presumptive eligibility that other states have, Florida does not have. First of all, what is it, and how do you think it can save lives?
Well, presumptive eligibility is on-the-spot, immediate, temporary coverage for the KidCare program so that when parents bring their children to a provider, such as a federally qualified health center, they can be determined eligible right away so that the child can receive immediate treatment and care rather than prolonging it and ending up in the emergency room where treatment is much more expensive and conditions become much more chronic and acute. So while the KidCare application is being formally processed
which
in
would
Tallahassee,
take what?
which takes months, up to months, there are eligibility determination factors. We already know that you have to be here a certain length of time or a citizen, and you have to make a certain income.
You can ask several questions
you
and
ask
kind
these screening questions and determine right on the spot that the child is KidCare eligible and the child can receive immediate treatment and follow-up care.
And this is on the table right now?
There are 2 bills in Tallahassee, thanks to Senator Nancy Dietert and Representative Gail Harrell, that would provide for presumptive eligibility at the federally qualified health centers, where we're seeing a lot of children who need this coverage.
Diana, traditionally, historically, immigrant children have not been covered by KidCare. Given the popularity of Latinos now and their importance as a voting bloc, is this the year that health care for immigrants gets fixed?
I'd like to think so, Mo. We started working on a bill sponsored by Senator Rene Garcia last year, and as you know, sometimes legislation takes a few years to pass. Made some headway with that. Have a wonderful champion in the House, Representative Jose Diaz. And like you said, there is an opportunity right now. Immigration is on the table. Everybody's talking about it. But this is a very unfair prohibition. This is a 5-year ban for children who are from parents who are qualified to receive this. When CHIP was reauthorized in 2009, Congressman Lincoln Diaz-Balart put a provision in this legislation that said we can remove this 5-year ban and children will receive this coverage immediately if states approve it. Well, Florida has not been one of the states that has removed the 5-year prohibition.
Okay, let me stop you right there because I want to clear this up. When you say a five-year ban, we're talking about legal immigrants.
Correct.
To begin with. And then what you're saying is they have to wait 5 years before they can apply for KidCare?
Correct. Right now, the federal government will provide the federal match immediately once the state provides implementing legislation, removing that 5-year prohibition, like many other states have done. 21 other states, California and many others have done this. So we just need to go ahead and do that so that these children don't have to wait for 5 years for something they're already eligible for.
So, and I think that it's important to note that it's legal immigrants. These are residents,
right, exactly,
that are either working or pay taxes. So we're not talking about a population that is not here already with a legal status and is contributing, which is always the question.
Okay, so what would you say is the hang-up in Florida? What is the hang-up?
Well, every year, the way our government works, especially in Florida, is we have certain people that we let in, and we have to work hard to get the next group in. We just don't say, this is good for all folks, and this is what we should do. So we do a patchwork of first doing citizens, and then maybe doing legal residents, and we do different income levels, and each time we do these things, we make it harder for people to get in. In some way, that's an economic driver because you're not putting out money for that at the state level. But in the big picture, in the long term, as taxpayers, we're all going to be paying more when people and children are sick and don't have good access to care.
But you know, the reality with a new Medicaid dollar is that it is 100% matched by the federal government. So from a state economic perspective, it makes total sense for there to be an expansion. And if these children become eligible for Medicaid or KidCare, because it could be for either one, then it's going to benefit the state in the long run to have these children funded in the healthcare system.
Maria, mental health parity has been an issue for as long as we've known each other, and you've been working in this area for a long time. After the shooting at Sandy Hook, mental health has sort of been highlighted in the media and has gotten a lot of attention. What can we expect from the Florida legislature on mental health issues, particularly for children and young adults?
Well, there's great debate going on. So far, there is no increase in the mental health budget. As a matter of fact, part of what we are trying to do is to get back the $25 million that were cut last year, and maybe even hopefully get more money. But again, as I was saying before, this is all part of that economic formula. I think that the legislature is thinking if we expand Medicaid, if we expand KidCare, a lot of these kids and families are going to be funded. So do we need to have additional mental health dollars? The issue is that mental health, there's always going to be an uninsured population, particularly in our county and in many parts of the state where you have people that just don't have the eligibility right away. So unless we have a pot of money in mental health where people can come and get screened, where they can get preventive services, where they can get the services they need immediately, you're always going to have the issue of the crises and the hospitalizations. Because no matter what, insurance is never going to pay for all mental health services. So you always need to have a certain amount of money to pay for what's not covered.
Well, best of luck to all of you during this session. We certainly have a big need, so good luck. Thanks, Maria and Steve, for being with us. I know you're going to stick around for another segment. We have to take a quick break, but in just 1 minute, we're going to talk about what the state is and is not doing for some of our tiniest citizens. If only they could vote.
Daycare, childcare, babysitting. It may not matter to you now, but it should. When you're on the job, your children are either learning or not. So before you drop your children off someplace on the way to work, think about whether that place is going to prepare them for the future. Find a star-rated childcare center near you by visiting thechildrenstrust.org. The Children's Trust, because all children are our children. It's not about the classroom or the computers or how much money you make. It's not where you live or where you come from. When it comes to kids succeeding in school, the #1 factor is
me.
Moi.
Yo.
Parents like me and you.
if you want to make a difference in your children's lives, read to them, be selective about their care, encourage them to get good grades. You have to be active and involved. To find the support you need, log on to thechildrenstrust.org. The Children's Trust, because all children are our children.
Welcome back. We're talking about important issues to watch this legislative session. Still with us, Diana Ragbeer, Director of Public Policy and Communications at the Children's Trust, and joining us now, Evelio Torres, CEO and President of the Early Learning Coalition of Dade and Monroe County, and Shalí Fagundo, the CEO and President of Inter-American Children's Learning Center in Allapattah. Evelio, last session there was a bill that would have stripped much of the quality standards and legislation impacting early care and education throughout the state. The governor vetoed it at the last minute. There's talk that it may be coming back. What do you hear? What do you know?
Well, that's what we hear. We hear that the bill is coming back, and when we are trying to serve children with limited resources, the issue of quantity versus quality always becomes the debate. And we know that we have too many children in the state of Florida that are still attending low quality childcare. And what we would like is to focus as much on quality as we focus on serving children. And there are just not enough dollars. So we are saying let's put sufficient resources to try to continue to improve the quality of childcare in Florida while we serve as many children as possible. If we take the approach of just the quantity approach, what we will be doing is basically warehousing children, placing them in any setting regardless of the quality without too much concern for quality. And this impacts obviously the public school system, because then we have children that enter the public school system without the basic knowledge and building blocks that they need to have a successful learning experience in the public school system.
Shalene, actually, any of you can answer this, but obviously education is a big topic in the session. But it seems like every time we talk about education and funding, we talk about K through 12. And it seems that the years between birth and 5 years kind of gets lost. Mm-hmm. Is that at the heart of the trouble with funding in early childhood education?
I think that is one of the leading reasons. I think that legislators understand that there is certainly a huge benefit to investing in early childhood programs. And they know that there will be long-term savings in this, but it does take a long view. They cannot expect to have a quick bang for their buck in this area. And so I think that it's daunting in the financial environment that we all live in right now to make that investment, which, you know, in a perfect world would be a significant investment without getting those immediate benefits. But I think that the push that's happened by the Children's Trust and the Early Learning Coalitions has made child care providers ready. There's been a lot of focus on quality programming. I think that if the state were to make that investment, many programs are ready to start ramping up what they're doing to change. Like Avelio said, the environment that children are just being warehoused. I think that the environment is there to make some changes if the state would put the money there.
Shalene is an owner of a child care facility. How do you balance quality and the number of kids you serve, and how does that play out for you?
Well, you know, quality is obviously the most important thing that I can do in my center. It's a day-to-day challenge. My goal, a personal goal in our school in Allapattah is, you know, I want to be the best center in Allapattah, which is a very low-income community in the city of Miami. However, you know, I have to look at what's going to create a quality program in my center, and then I need to evaluate on a day-to-day basis, how can I do that with the limited resources there are. You know, obviously, you know, there are large centers, there are small centers. Every business owner needs to make their own business model for how to balance those two things. I think that it is challenging for centers like mine that serve very low-income children and families, and also those centers that serve children with special needs, because those children who come from challenging socioeconomic backgrounds and who have special needs need many more things to get the same advantage and to be ready for school, and the funding is not there to provide that. So it is a kind of a day-to-day struggle to look at your business model and to look at your personal goals for achieving quality. I think that no center does all of them. Because it's not achievable in the environment that we're in right now.
Parents beware, no?
Exactly.
Well, you know, when we talk about quality, you know, the reality is quality often comes with a price tag. And of course, we were also talking about families that cannot afford. So I was wondering, Avelio, how many children, how many families are on the waiting list for subsidized child care? And is there still hope for those families on the waiting list?
Well, in Miami-Dade County alone, we have close to 11,000 children that are 0 to 5 on the wait list.
Wow.
And I think part of the issue here is that there's an identity problem with the area of early education. K-12 we know as education.
Right.
The identity problem comes in with the subsidized school readiness program, which is for low-income families, working parents. It's not welfare. It's for families that are working, trying to get on their feet. And of course, we know that if a family is working and making minimum wage or just above minimum wage, it's very difficult for them to afford childcare, particularly quality childcare. And the identity comes in, is this a workforce program or is it an education program? And we say that it's more of an education program with supporting workforce. And it's a big program that supports the economy. For the parents, it's extremely difficult because if you have 11,000 children on a wait list, it's going to take a very long time before your child has that opportunity to attend quality childcare through the subsidy program. Sometimes the child never makes it to the beginning of the list.
So Diana, the question is then how can parents stay informed and have a say in any of this? I mean, what kind of things can they do?
Thank you. So we want parents to, you know, certainly develop relationships with their, excuse me, their legislators, so that when they go to ask them to handle specific issues. There's already that established relationship. They can go to the Children's Trust website and subscribe to our Capital Connection. They can email and write and call their members. They can get involved by just staying informed on these issues and tracking them. And the Children's Trust website is certainly a great tool for that.
So advocacy does work.
It does. We've seen the difference it makes.
Well, Diana, thank you for your wonderful work and your advice. And Velia, Charlene, thank you so much for being with us. Good luck. We certainly need it in Tallahassee. Hope all goes well for you.
Thank you.
Don't go away. When we come back, Mo will talk to us about his retirement from public service next month, about his career and the future of the Children's Trust. Stay with us.
It's not all about the school, or the teacher, or the neighborhood you live in, but those books on the shelf will open many doors when you open them up and read to your kids.
Read.
Li.
Li. Read to your kids.
Let them read to you.
Because when kids read, we all succeed.
To learn more, log on to thechildrenstrust.org and click on Read to Learn. The Children's Trust, because all children are our children.
Welcome back. Although we know he has a lot of fight left in him, this is Mo's last show as CEO of the Children's Trust. He is retiring. But before we talk to Mo about his future and the future of the Children's Trust, let's watch him take a little walk down memory lane.
I began this journey in a very different time, in the mid-70s, which was really the late 60s, right? Because the 60s didn't end till about 1974. Young professionals were heeding JFK's call to do for our country. Young idealists were joining the Peace Corps, signing up to become public health nurses and doctors. Young lawyers were going into public defense and civil rights, and the public service was something honorable, and it was seen as a calling. We must lift the public service, and as I contemplate retirement, I believe that the time to stand up and speak up for the values we hold dear, for poor children and families, is now more than ever. I assure you that one way or another, as Arnold once said, I'll be back. The struggle continues. Thank you.
You know what? I have a feeling, I think he will be back. Knowing you, retirement, I think retirement to you doesn't mean like what retirement means to most people. You're not that kind of a guy, and I have a feeling that retirement to you is still going to mean a lot of the same work, and it's going to involve children somehow.
I think you're absolutely right.
Yeah.
The issues that I care about are not about a job. They're about a deep need to be involved in issues of social justice, of serving the poor, of equity, and social justice.
Anything in particular down the pike yet?
No, I just want to take some time off, do some kayaking, some bicycling.
Kayaking?
Yes, I
Hadn't
have
quite
kayaks. Yeah,
figured you kayaking.
yeah, I
But
have kayaks.
okay.
May buy a Harley and do some traveling. Lots of books that are at different stages of getting read. I'm going to enjoy this for as long as I can, and then really figure out what I want to do next and where I can be most helpful and productive.
When you started with the Children's Trust, Mo, you've been the only CEO the Children's Trust has had.
That's right. 10 years. We're into our 10th year. Our first vote to approve the trust.
Did you imagine in your wildest dreams that it would be this successful?
Oh, there's no way that it couldn't be. With the strength of the board and the staff that we've been able to bring in, we've hired the most diverse, the most competent, the best staff. We've created policies and procedures that are transparent, that hold programs accountable, and that stress quality. We've established a reputation for transparency, for ethics in public government, and the trust is on a very solid foundation on which to grow and just become better.
Well, I think people know that because, I mean, when some people may not know that the original vote had a sunset provision, and there was a second vote. Actually, you got more votes the second time around.
84% of the vote in 2008 to reauthorize a tax on property. So citizens in Dade County have voted twice to tax themselves to create and fund services for children and families. And the last vote was 6-1.
So I guess the question now is, Mo, what is the future of the Children's Trust without Mo Abeti?
The children of the future of the Children's Trust is bright and sunny, and property values are coming back, and so as the value of property rises, so rise the revenues of the Children's Trust. So the difficult period of having to cut back when revenues were down is over. I see nothing but growth and
even without
good times.
Mo at the helm?
Even without Mo at the helm.
Everything is in place to just keep on going.
We have a wonderful staff, a great place to work, and a very strong board that is not a rubber stamp, but real community leaders that care deeply about child and family social policy issues.
Thank you. Thank you for your commitment to the children in this community for 10 years. Best of luck to you. Godspeed. And it was absolutely wonderful working with you.
It's been a blast. Thank you, Ileana.
Thank you. Well, I am Ileana Varela, and on behalf of the Children's Trust and Modesto Abeti Gutierrez, thanks to all of you for watching this special edition of Our Children. Enjoy the rest of your Saturday, and remember to be a voice for your children during this legislative session and always.
Our Children is brought to you by the Children's Trust. The Children's Trust invests in programs and services that help make children healthy, safe, loved, ready to learn, succeed in school and in life. To access its funded programs and services in Miami-Dade County, visit thechildrenstrust.org or call the Children's Trust helpline at 211, because all children are our children.
The Children's Trust invests in programs that help improve the lives of children and families just like yours. Programs you can find at thechildrenstrust.org. If you live in Miami-Dade County and need to access these services, log on to thechildrenstrust.org or dial 211.